Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob SCHRUPP, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Hi folks, I'm Alex, physical therapist assistant,
I'm Mike, physical therapist assistant.
and this is the Total Knee Replacement Fitness Program, exercises immediately after surgery.
Immediately, right away, probably the day you have surgery later that afternoon.
Yep, this is right after you wake up. These are some things you might want to think about. 3 goals of this phase right after surgery. Number 1, preventing complications with your breathing. Your heart and your lungs have been through a lot. They need some recovery period. This is going to be a big goal to get them up and working again.
Yep. Goal number 2 is to increase circulation of your legs and your feet to prevent any blood clots from forming and to help the swelling in your legs, helping decrease the pain you're experiencing.
Yep, so those 3 goals, 1, 2, 3. And then note, we want to note, this is important, very important. Get ahead of your pain with your medication. Your doctor, your surgeon, he'll have, kind of like a protocol to follow, what he wants you to do for pain. Don't think I'm too strong for that, especially right off the bat. You can get behind in your pain management, and you can struggle from there.
They'll probably put you on a schedule of when to take your pills, how many hours, and then over time, within the first month, you'll slowly start to wean off of them and just take them as needed more.
But once you fall behind, it's hard to catch back up. So,
Yep.
All right, into the exercises. There's 6 exercises in this phase. We can do number 1 together because we have a lot of stress in our lives. All right, number 1 is deep breathing. And I don't want to get too technical with this. I mean, keep it simple. Basically, you want to breathe in through your nose, inhale, and out through your mouth. And you want to exhale longer than the inhale.
You can go different time in durations for this. You can inhale for 3 seconds, 5 seconds, whatever your lung capacity can handle. Just inhale slowly through the nose and then blow out your mouth.
Smell the roses, blow out the candles, and this is for pain and relaxation.
Yep.
And repetitions, it's hard to say. You might have to do this once every hour. You might have to do it once every 30 minutes. It just depends on how much pain you're in. So,
Yep.
All right, number 2.
Glute sets. So for this, I'm going to lay down.
And I'm going to get out of the way.
So the green tape represents me having surgery on my right knee. So I'm going to lay down. Are you going to give me a pillow?
Oh, you need one?
Yeah. Isn't this like a hotel?
There you go, sir.
Okay. First things first, you're going to lay flat on your back. And all you're going to do is squeeze your butt cheeks together. You've probably done this in the pre-surgery exercises as well. So I'm going to squeeze. I'm going to hold it for at least 5 seconds. 3, 4, 5.
And do about 10 of them, probably.
And I'm going to relax.
Yep. This is good for circulation, and you're not necessarily strengthening the affected body part, so you're just circulating blood, getting some strengthening started.
Yep, and then the stronger all your other leg muscles are, the more pressure it'll take off your knee while it's recovering.
Yep. All right. Let's move on to the next one. This is more of a positioning thing than an exercise, but hey, very important.
So we have a foam wedge here. We can link one down below if you want to buy one, or if you just have a bunch of pillows at home, you can use pillows. It doesn't matter.
Yep. So this is for swelling. So Mike is elevating his legs above the level of his heart. You can see his legs are above his heart.
Yeah, legs here, heart here. So whatever way you have to do that, you can do it in a recliner if your recliner goes back far enough, but this is, right away when you're probably still in the hospital.
Yeah.
I don't know if you're going to have a recliner in your room, but if you do, just make sure the position your heart is lower than your legs.
Yep, because the fluid, the swelling will go down your body if it's elevated because of gravity towards your heart. Your heart will pump it out, and then you will
Eventually excrete it through your urine.
You will pee it out. And after a knee replacement, we don't like to have you in a bent knee position
Too long.
too long. Early on, it's okay just to get by, but try to put as many pillows as you can to keep it as straight as possible, as much as your pain lets you. So.
And on to number 4 exercise is ankle pumps.
Yes.
You can do it in this position. You can do it in the other position I was in before. It doesn't really matter. All you're going to do, you're probably in the way of my ankles.
Pump those ankles. Am I out of the way? All right.
So just pump the ankles up and down. You can do as many repetitions as you want. You can do this seated on the edge of the bed. Doesn't really matter which way. You can do 10 to 20 reps of these. Do them as often as you please.
Again,
honestly.
great for circulation.
These are a good one when you like wake up in the morning or you just wake up from a nap and you're like really stiff and you're sore and you just want to start moving.
Yep.
You don't even have to do them together. You can like alternate them.
Yep.
Just try to control it a little bit.
It'll feel good. It'll feel good to do.
Yep.
And then, every hour you're probably going to want to do those.
Yep.
Then next one, number 5, we're going to ice.
So this is not an exercise.
This is not an exercise, but
It's important.
it's important. All right, so I have 2 ice packs here. You don't want to put the ice packs directly on the skin.
You
so
want
I'm gonna.
something in between. If you have thick pants or like jeans on, that's probably fine. If you have shorts on like I do, put something there.
And you would like, in a perfect world, you want something that's kind of pliable, that's going to mold around your new knee.
Yep. And even wrap the whole knee. If you have 2 ice packs,
Yep.
put one underneath, one above.
Sure.
You might get a cooler pack from your surgeon. Some of them do that. Those are super nice as well.
Yep.
You can make a homemade cold pack. They're probably going to send you home with some sort of cold pack.
Yep.
So use those wisely.
The rule of thumb is 15 to 20 minutes of icing and then rest for 2 hours between icing sessions.
Yeah,
So-
don't just leave it on for like an hour till it gets warm. Do like 15, 20 minutes. When you take it off, what happens is all the blood flow comes back to that area, and then you start getting all the nutrients, and it starts recovering faster. So
Yep.
you don't want to keep it on all the time. You want to like at least have it off for an hour or so before you put it on again.
Yep, it needs a break.
Yep.
And then number 6, this one, it might seem simple, but when you have a knee replacement, early on it's not real simple.
Yeah.
Just sitting at the edge of the bed, that's a start. If you're up for it, standing. Thanks for not hitting me in the head.
I
Standing.
tried not to.
Or, Mike would probably have a walker here in most situations.
Yep.
Walking if he's up for it.
Just get position changes throughout the day.
Mm-hmm.
It's going to help a lot. Don't lay in bed all day. That's about the worst thing you can do. That's what they used to do in the olden days, and it took a lot longer to recoup from
Yep,
surgeries.
yep.
So get up and move as often as you can. Don't overdo it. There's kind
Right.
of a gray area
Right.
of how much you need versus how much you don't need. If you're dizzy, super nauseous, maybe lay back down,
Yep.
but just kind of take it slow.
If you're not up for walking right away, don't feel like you're behind. You'll catch up.
Yeah.
All right, 6 exercises right after surgery. Good luck.
Check out all the other videos related to this program on Bob and Brad /programs.
Thank you.